My name is Dr. Hema Kanapan. I am a pediatric consultant and my expertise is pediatric gastroenterology. So anything that deals with gut problems, be it heartburn, reflux issues, feed intolerances, either in newborn or in the older child, as you know, there is a whole range of conditions. I also specialize in abdominal pain. Any issues that alters your bowel, be it constipation or be it loose stools. If you're worried about your child's weight, then of course I'm very happy to have a look. These are all the gastro-related expert opinions that I am able to offer. Alongside that, as a general pediatrician, I can also look at problems such as headache or anything that bothers your child's daily health. From a general pediatric perspective, I'm very happy to have an overview of things as well.
What are the signs that my child has a digestive problem?
So the signs that your child has a digestive problem, as we all know, digestive tract is a long one. So we start from top going all the way to the bottom, starting with the mouth. So if you have mouth ulcers that don't go away in a week and are recurrent and very painful, moving on to your throat, if food gets stuck in the throat or you have difficulty swallowing, then definitely you need to seek medical help. Moving on to this area where many people get symptoms of heartburn or indigestion. So if that is going to be a frequent occurrence or it's going to be persistent, not just, all of us have a night where we eat pizza or spicy food and then we have indigestion, but that's okay. But if the symptoms are going to carry on for longer, then you definitely got to seek medical help. Moving on to the big zone of your tummy, abdominal pain. So a stitch in the side of the tummy is completely okay, especially after they have played sports. But if it is a persistent sign and it's lasting longer and it's very painful and they're doubling up in pain, then I would definitely say seek medical help. Moving on to your bowels. Bowels can be either way. You can be constipated. An odd day of constipation when you know you've not had enough water or enough fruit is completely fine. But if it's a persistent sign, you definitely need to rule out other medical problems. Loose stools, a much more worrying feature, especially if it's frequent, persistent, or associated with blood and poo. Any of these signs that I've mentioned indicates signs of a digestive problem and it's time to go and see a doctor.
How can I tell that my child's stomach pain is serious?
Stomach pain is very common, which many children experience at some point. So how do you know that the stomach pain is serious? They've had it for a long time. The pain is persistent. The pain can be in very specific zones. If it's around the belly button, it's short lasting and they are completely fine doing what they are, that's fine. You don't have to worry. You can keep an eye on it and then see how things go. But if it's persistent pain, it's there in the right upper part where you have your liver and your gallbladder, where you have your kidney, in the lower right part where you have your appendix, then you have to really worry about. So the location of the pain, the intensity, if it is quite intense, then of course if it's not responding to paracetamol and it's an ongoing continuous thing, then you have to worry about it. The biggest red flag will be weight loss. So if your child is not gaining weight or in fact losing weight, you have to worry about it. If they are unable to eat, they say they are feeling bloated or full, or they start vomiting, they are feeling sick, then all of these are signs that you have to worry about it, because things like inflammatory bowel disease can be present with tummy pain and loose stools and weight loss. So these are the things you have to worry about.
What should a parent do about acute stomach pain in a child?
So we have seen previously about long-term pain, but there are children who've never had pain and have pain on the day. And many people ring me and ask me, when do I take my child to A&E or GP? So if the pain is very severe, not responding to straightforward painkillers like paracetamol or ibuprofen, your child is doubling up and you put your hand on the right lower part of the tummy and they wince in pain, you have to think of appendicitis. You have to take them to the nearest doctor, A&E, GP. And if they have fever and they're vomiting, it could be sign of a urine infection. Or if they have tummy bug, then of course you have to get yourself sorted. Particularly male patients, male children, they have pain which is felt in the tummy, but it actually comes from the groin, because you have testicular torsion where the testis is twisted. So that needs to be sorted out very urgently. In female adolescent patients, it could be pregnancy as well. So never forget to think about these things when you talk about pain in the acute setting.